So today we're going to talk about strategies to effectively integrate and optimize advanced practice providers in the urology care team. I have no disclosures. So first off, to fully understand, or to understand how to fully utilize APPs in urologic practice, we first have to recognize and acknowledge the challenges that face urologic departments. There's obviously a lot, but we focused on sorry about this. We've focused on a few here. The first is increasing patient volume. Obviously, there's an aging population, and as people live longer, they're more likely to develop age-related urologic conditions such as BPH, kidney stones, incontinence, cancer, etc. And so with this rising incidence of urologic conditions, we just have naturally higher volumes of patients to be seen. And so that contributes to time constraints. We have more patients that need to be seen. We have limited time to spend with them, and it's not only the time in the clinic with the patients, it's all the extra work that comes with the more patients you're seeing, more results, more documentation, more phone calls, more messages to respond to. And then you also have the effect of it on the physicians. This increased patient volume leads them to have more surgical responsibilities, so less time for them to see patients as well. And then we all know, too, that our patient population is increasing in complexity, partly because it's an aging population and also because just the population as a whole is getting unhealthier. So poor diet, lack of exercise, smoking all contribute to a rise in urologic issues and more difficult surgery. And then the last thing to note is just a shortage of urologists. There's only so many residencies, there's only so many residents that are graduating, and it just doesn't correlate to the number of patients, the rise in patients that we're seeing in practice. And then on top of that, you have older urologists that are getting really burned out with just the amount of work, the documentation, and everything that comes along with practicing, the increased complexity of the surgeon. So you're finding more and more urologists are starting to think about either retiring early or just scaling back their practice to find a little more balance in their lives. So as a department, a few years back, we recognized that we needed to expand our workforce in response to our patient needs. So we came up with a strategic plan to grow and operationalize our growth to meet our patient demands. So how did we do this? Well, first, you can't just go adding providers to the department. You have to identify the needs. So we looked at our new patient wait times, our utilization of our current schedules that we have, how long we are booking out for follow-ups, for cystoscopies, and understanding that in order to grow the department, that APPs would have to play a major role in this. So, and then we also looked at our referral queues, understanding where we had pockets of need. We are lucky to be a very big department, so we've been able to, we have a bunch of different subspecialties, so really kind of narrowing down what part of our department we were lacking in and where we needed to add growth to. So, so I know that they said this in my introduction, but we went from a department of 10 APPs to 26 APPs in the last 5 years. We span 9 locations throughout the region. We have both ambulatory, inpatient, and pediatric APPs that work for us. And so we're just going to focus on how we were able to successfully grow our team. So we identified these are the key components that we felt have allowed us to be able to grow successfully and also to retain our APPs that we have. So, and I'm going to go into each of these in more detail, but structured onboarding, collaborative care model, care team support, promotion of the APP role to patients, billing compliance, continuing education, and career development. So our onboarding, so we have a pretty robust onboarding program. So when a new APP comes to our department, on average, it's 6 months of structured orientation. Before I came into the department, we really didn't have a structured onboarding program. APPs might have come in and been trained for 2 or 3 weeks, and then we're just given a full schedule and we're, sent on their way, which really, long-term did not benefit us. So 6 months on average, that obviously varies. We get a lot of new grads. We do have a NP school as part of the institution, a lot of PA programs around us. So we have a lot of new grads that we're orienting. So those take longer, somewhere around 6 months. Obviously, if they have experience, it could be shorter. But with that, so anytime someone comes in, we will expose them to all aspects of urology. Even if we know that they're going to be kind of focused on an oncology track, we want to make sure that they have a solid foundation to build on. So we rotate them approximately 2 to 3 weeks, depending on the subspecialty. With different groups, we have them exposed to inpatient time, so they're doing consults, get them into the operating room to be able to watch surgeries, just so they can all better help them to form that foundation to be able to practice. Because when they're done and they're practicing, we all know that we continue to learn, but we really want to build them to be successful and feel confident when they're out seeing patients on their own. And then our training is primarily with our APP team and our physician team, who we work pretty collaboratively with. We assign weekly reading. All our APPs get the Pocket Urology guide that tends to be our Bible when we start, and then assign reading based on where they are doing their training for those 2 weeks. We make sure to do billing compliance education somewhere around like 2 to 3 months, so they have a better idea of what they should be billing for, making sure that they're compliant, and then we have our billing compliance officers meet with them again once they're up and running in practice to audit their charts and just make sure that everything is compliant. And then once they are independent, we start them with a reduced schedule, ramp them up to what our expected patient volume is for our practice, depending on the subspecialty, somewhere between 16 to 18 patients a day, which gives us a little bit of buffer sometimes to add in those acute patients. And then making sure that we continue to support them both with the physicians and the APPs in our group. So the next thing is the collaborative care model, and the collaborative care model can, mean multiple different things. But first, I just want to focus on the collaboration between physicians and APPs in our department. I don't know why this keeps moving. So currently in our clinic, we have a mixture, so our APPs have a variety of ways that we practice. Some of us practice independently 5 days a week. Some of us practice, most of us support a physician and have a one-to-one relationship, but even with that, we see patients on our own independently, both a mix of new patients, follow-ups, and post-op patients, and then depending on the complexity of the patient, we also work in shared clinics as well, where attendings and APPs work together to see more complex patient population. The benefits of that is that it allows increased access to our attendings for new patients, surgical consults, and cancer discussions. It allows the APPs to continue to learn and work collaboratively in the medical decision-making for patients. It also allows our APP team to be integrated into that care team from the beginning and expose patients to the collaborations, which allows patients to seamlessly transition to APPs. A lot of us will start with a new patient visit, and then they're seeing the physician, but after surgery, especially for their routine follow-ups, most of these patients are being followed by our APPs. And overall, this relationship really does help foster growth and develop that relationship between the APP and the MD. So the other part of the collaborative care model is the care team support. So not just looking at the collaboration between the physician and the APP, but the collaboration between the entire care team. So we've worked really hard to ensure that our APPs are recognized as providers and have the same support as physicians. So same nursing support, same space, same admin support to be able to do our job, which is to focus on taking care of the patient and the provider level needs that they have. So we worked really hard to delineate what each member of our care team can do to work at the top of the scope of their practice and really try to focus on that. And we've seen a big difference just overall in allowing us, as a provider, when you can focus on the work that you need to do and not focus on calling patients back to answer questions that nurses could educate them on, not filling out disability forms or FMLA forms. You have a lot more time to be able to do what you need to do, and helps with balance as well, because we all know it really never ends, right? You always have messages, you always have phone calls, you always have stuff you need to get to. So we use Epic, so we're an e-record, so we have pools to help with our in-basket messages. We get about somewhere around 400 calls plus a day in our office, so it was really important for us to be able to identify where these messages need to go to and make sure that they weren't just all getting forwarded to the providers, that the admin team got the messages they needed to do, the nursing team got the messages that they needed to handle, and they would triage them and then only forward them on to the APPs and to the MDs if they needed a provider level decision. Is that perfect? No, I mean, that constantly takes education, especially as you get new staff on board, and just working together with the team. So I'm very operationally driven within our department, and we meet with our nursing, our admin team, our staff, the leaders of those staffs once a week, just to make sure we can continue this efficient process of moving patients through. And then promotion of APPs to patients on promotion of APPs to patients on their role in the care team. So we made sure that all our APPs are on our website with photos and biographies, so when patients come to our website to get more information about the department, they can see that we're part of the team. When a new patient is set up, we're actually still working on this, getting a MyChart message to them, letting them know all the players, all the people that are on their team and who's going to be involved in their care. And then in these complex patient populations like we talked about, the APPs working collaboratively in clinic with the attendings allows the patient to meet them right from the get-go and to understand their role in their care. So the other thing we found very important, just continuing education. So we have APP-specific education sessions in our department. Actually pretty proud of this. One of our APPs kind of took this on once a month. We have one of our attendings or APPs from different departments come and present to us on a topic. We actually did a survey, found out what people wanted to get more education on, and so we've been doing these once a month. It's been really great, and then we save them all to our box drives, so then if people miss it, they can go back and they can reference it. We encourage grand rounds attendance, so we have grand rounds about 1 to twice a week with the entire department. Our department encourages national conference attendance, so we have a bunch of our APPs from our department here today. We continue with updated billing and compliance education, and then continue with mentorship as well. So all of these things, really, we're just trying to encourage and elevate the APPs in our department. Then we also focus on career development. So our institution makes us do yearly evaluations. I don't know, if you're at an academic center, you're probably familiar with this. Some of that process is a little tedious, but it does allow us to look at the past year, so to be able to sit down one-on-one, see how the last year went, see how what people's goals are for the next year and where they may need continued support, and establish goals for the upcoming year really allows our APPs to be able to think about what they want to do in the next 6 months, the next year, and it varies based on their level of experience, whether they want to start doing procedures, they want to start, a surveillance prostate cancer clinic. It really does vary, but it's a really good opportunity for us to just sit down and figure out where we want to go. And then within the institution ourselves, we always have opportunities for advancement and professional development, so we want to continue to support their growth. So what are our outcomes from all this? So we started with all these objectives of, understanding the barriers that we had due to these high patient volumes. And so by expanding our APP workforce, we have experienced improvements in operational efficiency. We've streamlined our workflows. We've improved our Press-Ganey scores have improved. Our new patient wait time went from, at one point, we were about 4 to 5 months out for new patient visits, and now we've gotten it down to 4 to 6 weeks. That always varies. We're constantly monitoring these metrics to understand when we need to add more to our care team, because if we're booking out, if we start to book out 4 months again, or our patient scores are going down, we always are reflecting on what can we do better and what's leading to this. And it's also, we've been able to create an environment where our APPs feel valued, supported, motivated to continue their careers. And as you know, it's pretty easy to find maybe another job in another department as an APP, not in urology. That might be easier, but urology has a lot to offer, and we're just happy to be able to have found a way to grow our practice, meet our patient needs, but also to grow and develop all our APP team. Any questions? That's all.